Hello and welcome to Newsmax TV. I'm John Bachman. Joining us now is Betsy McCaughey. Back in 1994, she warned the nation about the problems she found in then President Clinton's health care bill. She's now warning us about new problems with President Obama's Affordable Care Act. Her new book is called The Obama Health Care Law, What It Says and How to Overturn It. She's also a constitutional scholar, a former lieutenant governor of New York, and the president of Defend Your Healthcare. It's nice talking with you, Betsy.
Thank you.
Okay, well, a new CNN poll shows that 54% of Americans believe that President Obama would better handle the issue of health care than Governor Romney. He gets 45%. Specifically on Medicare, Obama leads Romney 54 to 43%. What do Republicans and Governor Romney need to do to improve the standing on this issue, and why is Romney so far behind?
Well, the important thing is to look at what science can tell us about this issue. The Obama health law takes $716 billion out of future Medicare funding and shifts it over to fund entitlements for people under age 65. This is going to force hospitals, hospice care, dialysis centers, home care to take care of the same number of seniors for much less money, hundreds of billions of dollars less money. And it's going to force hospitals to downgrade the care they provide seniors. This will cost tens of thousands of seniors their lives every year. And here's why. The science shows that when a senior goes to the hospital with a heart attack, for example, and is treated at a hospital that provides low-cost care, that senior is 19% at higher risk of dying rather than recovering from that heart attack and going home again. And we have found similar evidence for congestive heart failure, pneumonia, and several other common conditions affecting seniors. So we know that if all hospitals across the United States are forced to downgrade to this low-cost care, it is going to cost seniors their lives. And that's what the Annals of Internal Medicine shows in a recent article published in February of 2011. It actually calculates how many seniors lose their lives when they have to rely on this low-cost care rather than getting all the care they need to survive their illness.
I want to emphasize what you just said. Just to be clear, you've been talking a lot about scientific evidence, and you say it's going to be blistering for the Obama campaign, especially to seniors in the swing state of Florida. Specifically, what you are talking about is you say that the Obama health care law will lead to more seniors' deaths before they would have died otherwise.
Oh yes, there is no question about it that once hospitals are forced to downgrade care, seniors will die from conditions that they could have survived, recovered from, gone home to play with their grandchildren again if they had been treated at a higher cost hospital. The Annals of Internal Medicine, February 2011, presents data on over 2 million patients that show that patients treated at the low-cost hospitals, the kind of hospitals that the Obama health law will force all hospitals to imitate, seniors treated with that kind of low-cost care don't survive, whereas other seniors treated with higher cost, more intense care actually recover from those illnesses and go home and resume their active lives.
Now, Governor Romney is facing some backlash from conservatives for saying that he would keep parts of Obamacare if he were to be elected president, things like prohibiting insurance companies from denying coverage to people with pre-existing conditions. Do you think that criticism is justified?
Well, pre-existing conditions is really a smokescreen because so few people in the United States are ever turned down for health insurance because of pre-existing conditions. Medicare can't do it, Medicaid can't do it, employers can't do it when they provide health insurance, and only a very, very small fraction of people who buy individual policies have been turned down. In fact, when the Obama health law created a temporary remedy to that problem, only 66,000 people signed up over 2.5 years. So we're talking about something that really is a pretend problem. It was created by the Obama administration, and it's not an issue that Romney should even be sucked into.
Now, for the folks that are criticizing Romney, at least on his messaging in terms of health care, do you think the folks that are criticizing Governor Romney are justified for doing so?
Well, look, I'd like to get beyond the political spin and the political judgments and urge Americans to look at the scientific evidence. And what the evidence shows is that the Obama health law, taking all these hundreds of billions of dollars out of Medicare, will cost seniors their lives. And the reason is that hospitals will be forced to lay off nurses. When hospitals are forced to take care of seniors for less money, They don't do it by eliminating fraud, waste, and abuse. If they knew how, they would have already done that. Instead, they lay off nurses, and when nurses are spread thinner, patients push that button when they need help and they wait longer, too long in some cases. And we've seen the evidence that seniors will literally lose their lives when hospitals have less money to spend taking care of them.
What are the 3 most important reforms that you would like to see if there were a new law to replace Obamacare, should it be repealed?
Well, first of all, I would ensure that people can choose whatever kind of health plan they want. Unfortunately, the Obama health law forces everyone to enroll in a one-size-fits-all government-designed health plan. It forces many people to pay for things they don't need and can't afford. Secondly, I would make sure that the government takes its hands off your doctor's decisions. Right now, under this health law, Section 1311, for the first time in history, the federal government can actually dictate how doctors treat privately insured patients. So even if you bought a health plan with your own money, the government is still in charge of your care.
And any other reforms that you think would be vital to a better health care law?
Oh, very important. Tort reform. That is raising the cost of health care enormously. Fourthly, allowing people to buy health insurance across state lines, so people in states like New York, where health plans are very, very expensive, can go to another state and buy health plans at a much more affordable cost. There are many, many reforms that can be put into place, but the first thing that has to be done is to repeal the Obama health law in its entirety, because this health law is deadly to seniors. Seniors pay for more than half the cost of this entire law because of cuts in Medicare, more than all the tax hikes and new taxes in this law, and there are $503 billion in tax increases here. Much more than that is the sacrifice made by seniors. This law is deadly for seniors.
Betsy, I know there is one provision of Obamacare that particularly concerns you, and that goes into effect just next month in October. Tell us about it.
One of the provisions of this law goes into effect in just 1 month, October 2012. At that point, hospitals will be penalized for spending more on seniors, and hospitals that spend the least per senior will be rewarded. So hospitals, in effect, will be pressured to adopt the lowest standard of care in order to earn those bonuses, rather than providing all the care that seniors need. So when the president says that the Obama health law only cuts what providers are paid, not what seniors get, don't be bamboozled by that. When hospitals are allowed to spend less, it hurts seniors.
Well, there are a few people out there who know the law better than you do, and I know you get quite a workout from bringing it pretty much everywhere you go with you. Betsy McCaughey, thanks so much for being with us today.
Thank you.